All of us have been ill at least once in our life. Our attention is then turned to medical professionals in hopes of getting to overcome this illness. These medical professionals prescribe various treatments to patients and often will perform procedures to those who need the extra care to make them healthy again. However, there are treatments and procedures that patients will desire that some medical professionals will refuse to administer or perform. In one of my previous classes, this was a topic of discussion. Can it be ethical for a doctor to not treat their patient? Even though the patients are mentally competent and the treatment is within their professional skill, the medical professionals should have the right to deny the treatment that they may find unethical. The reason these professionals refuse engaging in treatments is because of how they consider them to be futile, harmful, or immoral. Medical professionals should be able to refuse treatment if it conflicts with good medical practice. Here's an image of a medical professional denying treatment. There is a black and white area when it comes to healthcare. There is no gray area in between. Medical doctors are people too, and they are capable of making their own decisions. They pledge themselves to practice safe and effective methods when providing their services. However, there are times when a patient's wish is out of their ordinary and conflicts with good medical practice. For example, according to Albany Medical College, some patients have requested amputation of healthy limbs. This is an image of a patient who wants an amputation of a healthy limb, and they got what they wanted. Oftentimes, these patients could be completely healthy individuals who feel as though a particular limb was not meant to be on their body. In this case, the patient will wish for the limb to be amputated. When this patient seeks this amputation from a medical professional, the surgeon is going to raise some concern to the patient. One of the first things that they will question is if the patient is mentally competent to make their decision. Why would somebody want to cut off a perfectly healthy limb when there are others out there in the world who have a limb to be amputated? An experienced surgeon in this case has engaged in many situations where they have amputated a patient's limb to ensure that the patient will be able to continue living their life. As a healthy patient seeking this type of procedure, the surgeon should be able to refuse treatment because of how their experiences and their own self-beliefs interfere with the patient's requests. However, the patient does have the right to seek the medical treatment they want and have the procedure executed. In healthcare, there are a number of different individuals who are specifically trained in many areas who hold similar yet different beliefs. If one medical professional declines treatment, they can respectfully hand the patient off to another medical professional who can meet the desires of that patient. Medical professionals can refuse to provide treatment in certain situations. In healthcare, there are many different departments that are responsible for treating different types of patients. For an example, here is an image that shows many different healthcare fields. In a hospital, there is an emergency department, cardiology, neurology, oncology, the ICU, and more. According to the New York Times, those who work in the intensive care units should be able to limit treatment to those who are terminally ill. Some people believe that treating these terminally ill patients serve no benefit, but the doctor must abide by the desires of the patient and their loved ones. For example, a patient could be suffering from lung cancer and respiratory failure. In this case, the patient would be required to have a ventilator in order to keep them breathing. This ventilator is what is keeping the patient alive. Since the patient is in a vegetative state and cannot make any forms of communication to decide whether or not they want to live this way or turn the machine off and let them die, the loved ones who are present are the ones who get to make the final decision. Many people will refuse to turn off the machine and watch their loved one die. However, some hospitals cannot keep pushing further treatments for the patient who are terminal. In this case, the medical professionals can give the family the option of transferring them to another hospital, where they could be in an escalated treatment, or the treatment could be scaled back and the plug could eventually be pulled. Some may argue that the doctor should do whatever they can in order to keep the patient alive. This could mean leaving the patient on the machine for as long as possible, depending on the patient's state or condition. This could be forever. especially when the patient is in a vegetative state and has no way of communicating their own wishes. The family members will take over and make the decision for them. Oftentimes, the family will wish to keep them on life support forever. They are not ready to see them go yet and still want to hold on to the hope that is left for their patient. At this point, they are in a very vulnerable state and want the doctor to do everything and anything they can do to make sure that their loved one stays alive. As a medical professional, one has to be competently trained in their area of practice in order to successfully treat their patients. However, they also have their own morals and rights outside of their area of practice. They also have personality characteristics that consist of being honest and compassionate. From the example above, it can be seen how difficult it is to make decisions that require putting an end to a patient's life or obeying the wishes from those who cannot make the decisions themselves. This is an example of a doctor who has a hard decision to make. The terminally ill patient from above is in a vegetative state and cannot live on their own. First things first, this can be very hard for the patient's loved ones to witness. They are already in distress about their loved ones being terminally ill and they are not ready to let go of them yet. Therefore, they want to be able to physically see their loved one, even though they do not show any other physical characteristics of being alive, besides a ventilator to help them breathe. In this particular case, they do not understand that their loved one is going to make any progress to live on their own yet. They will be on this life support machine for the rest of their life, and it will also be a part of their job to abide by the patient's wishes themselves. Many terminally ill patients do not want to spend their remaining days on a hospital bed, hooked up to a machine that keeps them alive. They would rather have the life support removed and make their way into the afterlife. This can be a very difficult decision for the family to accept and may not be desired from them. Therefore, it is a part of a medical professional's job duty to enlighten their minds and give them another way at looking at the situation. Medical professionals are thought to always put the patient's needs above their own self-interest or beliefs. However, they are also individuals themselves and have the right to free choice. It is thought that many medical professionals will engage in such behavior in their profession that matches their own self-identities. However, at the same time, this idea of freedom is limited. Medical professionals should be able to refuse treatment to patients because they can be futile, harmful, or immoral. Forcing these medical professionals to treat patients violates the 13th Amendment of involuntary servitude. This is an image of involuntary servitude. There is no gray area in the Constitution either. Therefore, medical professionals should be able to refuse treatment in certain situations.